Welcome back. Thanks for joining us today. It is cutting edge technology that we're seeing. And, you know, it's really making LASIK surgery safer for more people here in San Diego. Joining us now to talk about it is Dr. Sandy Feldman with Clearview Eye and Laser Medical Center. Good morning, doctor.
Good morning.
So LASIK is not new, but as a doctor, you're finding that a lot of people are still coming to you with questions about how does it work and could it work for me?
Absolutely. There are a lot of conditions that people don't know can be treated with LASIK. And LASIK is great for many, many people.
Okay, let's talk about some of these myths because I think that this is something that you probably see oftentimes in your office. The first one is LASIK isn't real surgery.
Yes, it is.
It seems like surgery when you know, there's any sort of cutting involved.
Right. Although it's rapid, LASIK is absolutely real surgery. It's important to have lots of tests before the procedure and have your follow-up after. We take it very seriously.
Okay, what about this? I often hear people say that you can't do the LASIK until your eyes have completely stopped changing, and that happens maybe around your 40s.
No. We can begin to have LASIK at about the age of 21. When the prescription is stable and hasn't changed for about a year period of time.
Oh, only a year?
A year,
okay.
And you can totally have LASIK. Don't wait till your 40s.
Okay, get it done earlier so you can enjoy it.
Exactly.
Right? What about astigmatism? It's very common, right?
Correct.
Can you get the surgery if you have one?
That is one of the biggest misconceptions. Now, first of all, do you like football or basketball?
I like both.
Well, which one better?
Okay, I guess I'll go football.
Okay, well, when you have astigmatism, your eye is shaped like a football, but a normal eye is shaped round. LASIK is a terrific procedure for astigmatism.
Okay, so you could do it either way.
Absolutely, you can absolutely do it, but so many people don't realize that when you have astigmatism, you can be treated.
I was always told that I could not get LASIK because I have chronic dry eyes, and that my eyes are just too dry. Is that another myth?
That is. There are lots of new treatments for dry eye. And so people who do have dryness, we have to determine why it's dry, to treat that first, and then absolutely you can have lots of procedures.
Okay, good. I need a few procedures. Okay, and what about this? A lifetime guarantee after LASIK. Does that mean that your eyes are always going to stay as they were just after the surgery?
Well, you don't need a lifetime guarantee. If you choose and pick the right doctor, LASIK will last for years and years to come.
Okay, that's good to know. And that brings us to our truth, because you said that there are some really positive benefits about getting LASIK.
The first is it's totally amazing, and it's really true. LASIK can make you happy. And did you know the part of our brain that controls happiness also controls fear or danger? Something we're always worried about with our eyes. But it's absolutely true that LASIK can make you happy. Well, it gives you meaning and a lot of pleasure when you can see the world and the beautiful outside.
Well, and I've heard so many people who get LASIK say that it's just so nice not to have to wake up and put in your contacts and deal with the solution and all that stuff.
That's right. No more hassles of solutions. And think of the airport, waking up in the morning, seeing the alarm clock. Fantastic.
Well, right, and that's the other thing is you don't actually really know what you're missing until you wear glasses or get contacts for the first time, but for LASIK, it's 24/7.
Exactly, exactly. And what else do we do, kind of, that we use our eyes 16 hours each and every day? And it gives us great joy and pleasure to see all the beautiful sights of San Diego.
Yeah, and is the recovery time the same? I mean, a lot of people can get back to work the next day or that day?
Absolutely. The next day is preference.
Okay. But and you just have to cover your eyes for the rest of the day?
You don't even cover your eyes. You go home, take a nap for a few minutes, for a few hours, and when you wake up, you begin to see the world. In fact, one of the most things that I enjoy the most is everyone smiling.
I bet. That must be nice. Well, Dr. Feldman, thank you so much for joining us this morning, and we hope you cleared up a few issues. I know I do need to get it back into the eye doctor because my doctor told me that years ago.
Absolutely. You might be able to have it and have a bigger smile.
Well, that would be great. I haven't worn contacts in years. Okay, doctor, thank you so much for joining us today.
Thank you for having me.
Okay.